There is a growing risk in West Africa where the disease proves to be too much for the government to handle. Debora Patta is in Johannesburg, South Africa, tracking violence and fears surrounding its spread. Debora, good morning.
Good morning. The Ebola outbreak in West Africa is spiraling out of control, according to health officials who are warning. And this is largely due to dysfunctional healthcare systems and rampant fear. The fear and mistrust took a violent turn in Liberia's capital, Monrovia. An angry crowd, many of them armed with clubs, raided an Ebola isolation ward in the city's largest slum. They were shouting that Ebola did not exist and was a hoax by the Liberian president to get money. The mob looted the clinic, removing contaminated medical items and soiled bedding. Over 20 patients infected with the virus fled the treatment center. Some have been rehospitalized, though health officials remain terrified that the infection could spread across the entire area. Treatment centers are filling up faster than they can be provided. Doctors Without Borders is building 2 new isolation units in Monrovia, but emergency coordinator Linda Huram says this will not be enough.
Because at this stage, the outbreak is totally out of control, and we need to come up with other strategies to cope with the situation.
And the situation on the ground is desperate. Already the death toll is well over 1,000 and the number of cases nearly 2,000 as international organizations scale up their response. But even with the added help, health officials say the outbreak could continue for another 6 months. Doctors Without Borders say the Ebola outbreak is like war, and as fear and panic spread, other African nations are being caught up in it. Kenya, a central hub to much of West Africa, is the latest country to ban flights to all affected areas. Nora?
All right, Deborah, thank you.